Half of American citizens receive insurance through their jobs. A third are covered by the government through Medicare or Medicaid. 1 in 10 buy insurance themselves, and sadly, another 30 million of American citizens will not have insurance at all. Now, I personally believe that we should help those other 30 million people get the insurance coverage they need. Since President Barack Obama has been in office, he has greatly influenced the issue with healthcare. This Healthcare Act that Obama has passed is supposed to expand coverage for Americans and reduce the cost of health insurance. This act is known as the Affordable Care Act. The majority of these American citizens who don't have health insurance either, 1, can't afford it because A, they don't make enough money, B, because they have a pre-existing condition, and insurance companies and healthcare plans are concerned about their financial bottom line. It is in their best interest, therefore, to exclude people with a pre-existing condition, impose a waiting period before coverage starts, or charge higher premiums and out-of-pocket expenses. And C, in some cases, health insurance companies will not carry a policy with someone with a pre-existing condition. Or 2, they can afford it but will not buy it. These people will have to follow the individual mandate. This requires all Americans who cannot afford health insurance to purchase a policy or pay a tax penalty for failing to do so. You have probably heard negative energy surrounding the topic of the Affordable Care Act. Unfortunately, you have not heard about the benefits from the Affordable Care Act that will help American citizens. Do you want to know how? Here are 12 benefits the Affordable Care Act will provide. Number 1. Improve access to affordable health coverage for everyone and protect consumers from abusive insurance company practices. Number 2. People who already have health insurance will receive new benefits, better protection from insurance company abuses, and more value for every dollar you spend on healthcare. 3. Insurance companies can no longer deny coverage to children or adults because of a pre-existing condition, which will provide a peace of mind for parents of more than 17.6 million children. 4. Insurers can no longer impose lifetime dollar limits on essential health benefits. More than 105 million Americans no longer have lifetime limits thanks to the new law. Number 5. If insurance companies don't spend at least 80% of your premium dollar on medical care and quality improvements rather than advertising, they will have to provide you a rebate. Number 6. Insurance companies are required to publicly justify their actions if they want to raise rates by 10% or more. Number 7. The government will subsidize small business owners, employees, health care coverage. Number 8. Insurers are now required to cover a number of recommended preventative service without additional patient costs in their copays or deductibles. Number 9. Young adults can stay on their parents' plan until age 26. Number 10. Consumers are provided with exchanges, which will help them select private healthcare plans that meet their healthcare needs. In addition, consumers are provided with consumer assistance, shopping, and enrollment. Number 11. 3.6 million people with Medicare receive a 50% discount on their brand name prescription drugs. Seniors will also see additional savings on generic drugs. And number 12. Seniors can receive recommended preventative service free of charge. Jobs. What is the impact of the Affordable Care Act on jobs? Is the Affordable Health Care Act really a job killer? The Affordable Health Care Act does affect job growth, hiring, wages, and consumer costs. However, the impact of the Affordable Care Act on jobs is not as drastic as you might have heard. The Affordable Care Act includes provisions that create new jobs in healthcare and government, increase operating costs for some larger businesses, and save money for small businesses. In the past, companies would cut back employees' hours to part-time to avoid paying for the health care coverage. This is not allowed anymore. The Affordable Care Act will create jobs in two ways. Our tax dollars will go to creating millions of new government and healthcare jobs. This includes funding for improving training for young adults getting trained in healthcare, new jobs in the health insurance marketplace, new jobs in the health education, and new jobs in the IRS. The Affordable Care Act will also fund scholarships and loan repayment programs to assist young adults going into the medical field. Since more people will be able to access medical assistance, doctors, nurses, and other healthcare providers will be in high demand.